चलिए दोस्तों बात करते हैं OSSC नर्सिंग ऑफिसर जो 2023 का एग्जाम हुआ है वो क्वेश्चन पेपर का आंसर कीज। राइट, अभी नर्सिंग ऑफिसर का जो एग्जाम हुआ उसमें मैथ का पोर्शन भी था, इंग्लिश का था और फिर सब्जेक्ट क्वेश्चन था। आज बात करते हैं जो सब्जेक्ट क्वेश्चन नंबर 16 से 100 तक है वो पूरा क्वेश्चन का आंसर। चलिए तो शुरू करते हैं क्वेश्चन नंबर 16 से। Which hormone is responsible for the secretion of milk after parturition? Answer will be option B, prolactin. Question number 17. A boy is admitted into the hospital with a history of projectile vomiting after each feeding. On examination, it is found that the pyloric sphincter is thickened and does not open readily because of the boy's lost gastric juice. His blood probably indicate. The answer is option C, alkalosis. Next question, question number 18. ESR is considered to be the measure of the following blood physical chemical property. The answer is the blood suspension properties. Question number 19. Light rays entering the eye is controlled by option A, pupil. Question number 20. Gallows traction is used for. The answer is fractures shaft of the female. Question number 21. An infant is to receive thyroxine sodium 0.35 mg once a day orally. The medication is available in elixir form 0.25 mg per milliliter. How much elixir should the nurse administer? Answer is 1.4 ml. Question number 22. As a safety alert, the nurse is aware the following medication is never given directly IV or intravenously. The answer is potassium chloride. Question number 23. An ABC analysis report shows pH 7.20, PCO2 35 mmHg, HCO3 minus 20 milli equivalent per liter. These findings are suggestive of metabolic acidosis. Question number 24. A client is to receive 2000 ml of IV fluid in 12 hours. The drop factor is 10 GTT per ml. At how many drops per minute should the flow rate be set? Answer is 28 drops per minute. During ABG analysis, blood is collected from the appropriate answer is artery. Question number 26. When taking apical pulse, where should the nurse place the stethoscope? Answer is option B, the fifth intercostal space at the left midclavicular line. अभी मैं थोड़ा सा आपको ये बता दूं कि जो अभी हम क्वेश्चन सॉल्व कर रहे हैं ये सारे सेट ए का है, सेट बी सी का क्वेश्चन रिसफल किया गया है। इसका मतलब है क्वेश्चन तो सेम है पर थोड़ा इधर उधर रिसफल किया गया है। ठीक है, चलो तो आप अगर देख रहे हो सेट बी और सेट सी के लिए थोड़ा ये भी देख लेना कि क्वेश्चंस इधर उधर हुआ है तो ये मैच कर लेना थोड़ा। Question number 27. For IM injection, the nurse should insert the needle into the muscle at the angle of option D 90 degrees. 28. Question number 28. The nutrient that provides the body's preferred energy source. The answer is option D, carbohydrate. Question number 29. A nurse observes that the fingers of the casted forearm of a patient with fracture ulna are pale, cool, and capillary refill is delayed. She has to interpret it as option B. Correct answer. Arterial blood supply to the finger is reduced. Question number 30. While giving NG tube feeding, which of the following nursing actions prevent complication? The answer is provide high phallus position. Question number 31. All of the following nursing interventions are correct when using the Z-track method of drug injection except the answer is option D. Rub the site vigorously after the injection to promote absorption. This is wrong and the answer is this one. Question number 32. A nurse is about to catheterize bladder of a pregnant lady. She should be aware that all the following facts about the female urethra are true except the urethra is posterior to vaginal orifice. This is wrong and usually it is present in anterior part. Question number 33. To do the percussion and postural drainage of the lung in bronchiectasis, what body position of the patient a nurse should use? The answer is prone position. Question number 34. The elbow is to the wrist. Elbow wrist के हिसाब से कहाँ पर है? wrist के हिसाब से elbow कहाँ पर है? तो आंसर is Option D, proximal. Question number 35. Gita returns from the post-anesthetic care unit or recovery rooms with an nasogastric tube in place following a gallbladder surgery. She continues to complain of nausea. Which action would the nurse take? Answer is check the patency of the nasogastric tube for any obstruction. Question number 36. A client is scheduled for a bronchoscopy. When teaching the client what to expect afterward, the nurse's highest priority of the information would be the food and fluids will be withheld for at least 2 hours. Question number 37. The client presents with severe rectal bleeding, 16 diarrheal stools a day, severe abdominal pain, tenesmus, and dehydration. Because of these symptoms, the nurse should be alert for other problems associated with this disease. Answer is option B, ulcerative colitis. Question number 38. An adult has just been brought in by ambulance after a motor vehicle accident. On assessing the client, the nurse would expect which of the following manifestations could have resulted from sympathetic nervous system stimulation. Answer is option number A, rapid pulse and increased respiratory rate. Question number 39. A nurse is performing CPR on an adult patient. When performing chest compressions, the nurse understands the correct hand placement is located over the lower half of the sternum. In case of adult, it is lower half of the sternum. In case of infants, we can use like lower one third of the sternum. Question number 40. The client has clear drainage from the nose and ear after a head injury. How can the nurse determine if the drainage is CSF? Answer is test for glucose. Question number 41. The nurse is performing CPR on an adult patient. When performing chest compressions, the nurse understands the correct hand placement is located over the lower half of the sternum. Question number 42. Which of these diseases cause predominantly sensory loss? The answer is ये थोड़ा सा कंफ्यूजिंग है. लीड पॉइजनिंग एंड गुलेनबर्ग सिंड्रोम के बीच में कंफ्यूजन है. Question number 43. Which of the action could aggravate the cause flare-ups in a patient with the pruritus? Answer is daily bath with the fragrant soap. Question number 44. After receiving a report, which of the following patients should be the nurse see first? Answer is option A, a patient in the sickle cell crisis with an infiltrated IV. Question number 45. The nurse must know that the most accurate oxygen delivery system available is option A, the Venturi mask. Question number 46. Which of the following condition is manifested by the increased intraocular pressure? Answer is option number D, glaucoma. Question number 47. Which of the following is a specific investigation to detect seizure? Answer is option C, EEG. Question number 48. A major goal for the client during the first 48 hours after a severe burn is to prevent hypovolemic shock. The best indicator of adequate fluid volume balance during this period is option B, urine output 30 to 50 ml per hour. Question number 49. To avoid pulling the urinary catheter, the nurse should tape the catheter on patient's upper thigh. Question number 50. A 55-year-old male patient who is diagnosed with an evolving myocardial infarction insists on going home. The nurse encourages the patient to be admitted because the greatest risk within the first 24 hours of sustaining an MI is sudden death. Question number 51. The nurse has to apply erythromycin ointment to a newborn child. Which area of eye she is supposed to place it? The answer is lower conjunctiva. Question number 52. A nurse is carrying an anemic patient. What findings should suggest her that it is acute blood loss anemia? Answer is postural hypotension. Question number 53. 30 years old patient has an ulcer over the lateral malleolus. The nurse caring for this patient understands the pain of the patient is due to the ischemia. Question number 54. A parent brings a toddler aged 18 months to the clinic for a regular checkup. When palpating toddler's fontanelle, what should the nurse expect to find? The answer is closed anterior and posterior fontanelle. Question number 55. A 1-year-old child presented to the OPD with the history of short stature, tiredness, and constipation. Examination revealed a palpable goiter. Serum 24 was decreased and TSH level were increased. Which is the most probable diagnosis? Answer is thyroid. dysharmonogenesis. Question number 56, depression. The answer is both B and C are the correct answer. I mean D. Option D is correct answer. 7, question number 57. A client is admitted to the psychiatric unit of a local hospital with a chronic undifferentiated schizophrenia. During the next several days, the client is seen laughing, yelling, and talking to herself. This behavior is characteristics of option D, hallucination. Question number 58. A client with the chronic schizophrenia who takes neuroleptic medication is admitted to the psychiatric unit. Nursing assessment reveals rigidity, fever, hypertension, and diaphoresis. These findings suggest which life-threatening reaction? Answer is neuroleptic malignant syndrome. Question number 59. When teaching a patient who has a diagnosis of schizophrenia about success, independent life living in the community, a nurse should encourage the patient to establish a structured daily routine. Option A is correct answer. Question number 60. This drug which is used to create aversion in the alcohol dependence, the answer is disulfiram. Question number 61. Best test to detect iron deficiency in the community, the answer is option D, hemoglobin. Question number 62. Inadequate intake by the pregnant woman of which vitamin can cause neural tube defect, answer is folic acid. Question number 63. Human milk is rich in all except, the answer is option C, iron. Question number 64. In HIV, maximum risk of transmission is by option B, blood. Question number 65. Which is the most commonest side effect of copper T among the following? Answer is option B, bleeding. Question number 66. MTP can be done up to option C, 20 weeks. DOTS is used in the treatment of, answer is option A, tuberculosis. Question number 68. A freshly prepared ORS solution should not be used after 24 hours. Option D. Question number 69. Which of the following signs will indicate that a young child is suffering from severe pneumonia? The answer is option D, chest indrawing. Question number 70. A patient gives a history that she has missed a single dose of a combined oral contraceptive pill. Which of the following will you advise her? Option B. Take 2 pills in the next day and continue with the course. Question number 71. Which of the following factor may affect the drug absorption rate from IM injection site? Answer is option D, blood flow to the injection site. Question number 72. The drug that increases both systolic and diastolic blood pressure for prolonged period is option B, ephedrine. Question number 73. Paracetamol is an antipyretic, option A. Question number 74. Glucose added in ORS to increase absorption of the sodium, option D is correct answer. Question 75. Side effect of oral contraceptive are all except, answer is increase the risk of ovarian cancer, option D is correct answer. Question 76. During home visit, the nurse Mala found no signs of dehydration in 7 weeks old child who had diarrhea for last 2 weeks. The child is having persistent diarrhea. Question number 77. Following vasectomy, for family planning, a patient should be advised to use some other method of contraception till 8 weeks. Question number 78. Which of the following tools does a nurse use to assess the cognitive function of a client? Answer is mini mental status examination. Question number 79. 60 years old man had undergone cardiac bypass surgery 2 days back. Now he started forgetting things and was not able to recall the names and phone numbers of his relatives. What is the probable diagnosis? Answer is option C, cognitive dysfunction. Question number 80. A client is experiencing anxiety attack. The most appropriate nursing intervention should include dash. Option C, correct answer, staying with the client and speaking in short sentences. Question number 81. When is the best time to achieve pregnancy? Answer is option C, 14 days after the beginning of period. Question number 82. Inspection of the uterine cavity by endoscopy with access through the cervix is known as hysteroscopy. Option number A is correct answer. Question 83. Which among the following is correct regarding iron supplementation? Answer is option B, take it along with the lemon juice. Question number 84. What do we mean by the first stage of labor? Answer is option A, onset of true labor pain to full dilation of the cervix. Question number 85. The most common type of ovarian cancer is epithelial ovarian cancer. Option C is correct answer. Question number 86. Identify the high risk infant among the following. Answer is infant with the birth weight 2 kg. Question number 87. What should be the temperature of delivery room to maintain warmth of for newborn? Answer is option B 25 to 28 degrees centigrade. Question number 88. Which among the following conditions required repeated blood transfusion? Answer is option C thalassemia. Question number 89. In an infant, the important clinical finding which makes one to suspect increased intracranial tension. Answer is option D bulged fontanelle. Question number 90. Which is the common nutritional problem associated with the Down syndrome? Answer is option A obesity. Question number 91. Drug of choice to treat leprosy. Answer is dapsone. So option D is correct answer. Question number 92. Which of the following item is not sterilized by antiseptic solution? Answer is surgical seizure. Option C is correct answer. Question number 93. Most effective mode of transmission of HIV? Answer is option B blood product. Question number 94. When the patient is acquiring infection from another patient, it is known as cross infection. Option A. Question number 95. Most common site of extrathoracic TB in children? Answer is lymph node. Question number 96. Which of the following is significantly different between human and cow's milk? Answer is protein and lactose. Question number 97. The substance deposited in the skin and sclera in jaundice is the indirect or unconjugated bilirubin. Question number 98. Iron deficient in? Option D milk. Question number 99. Main function of the vitamin C in the body is involvement as antioxidant. Question number 100. Phenylketonuria is detected by which urine test? Answer is option D ferric chloride test. Thank you for watching. Please like, comment and share. Jai Hind.